Joining us now in the studio is Michael Bronfein, CEO of Curio Wellness. Sir, thank you for being with us.
Thank you for having me.
Tell me about the company. What do you do?
We are a manufacturer of branded products derived from cannabis. So we cultivate the plants in order to convert them into oils, and then we purify, separate, and reformulate those oils into various types of medicinal forms: capsules, tablets, ointments, lotions. We also are a provider of what we refer to in the industry as flowers, but only at the very premium level.
How far along are you at this point?
We are just about to harvest our first crop, and we expect to do that on November 5th. That'll take about 4 more weeks of curing and testing before that'll be ready for market. So at the end of November, we'll start distributing flowers, and next week we'll actually begin manufacturing the Dixie line of consumable products and some of our vape products and tinctures.
What does it take to get it from plant form to a product that you can legally sell in Maryland?
There's a series of pieces of equipment you use to first extract the oil from the plant using CO2 gas and pressure, and then use a number of other tools and instruments to purify that oil. Depending on how pure you want it to be or need it to be, there's a series of steps to take. And then once it's in its oil form, it's formulated into the product like any other product would be, and run through either manufacturing equipment to make a tablet, for example, or some type of mold or press into packaged materials.
I sort of joked about it at the beginning that it's been 4.5 years since this became law in the state of Maryland, but you're near the finish line.
Yes, we are, and we're very excited because we got into this effort because we really saw a great opportunity to bring cost-effective and reliable medicine to the folks of Maryland, particularly folks that don't benefit from traditional pharmaceuticals. That said, I think it's important that the public kind of have the expectation that this is going to be a slow start. You've got a long cycle of cultivation to get enough product to fill up the channel, if you will. You've got retailers that are just getting off the ground, and of the 102 approved dispensaries, I believe only 3 or 4 have been licensed to date, and it's my expectation that maybe 20 or 25 more will get licensed by year end. So even by the end of the year, probably only have about 25% of the distribution available in the state that will ultimately have. So it's going to take some time.
So from the standpoint of the consumer, they don't really need to know about the growing part, I guess, but the consumer-facing part is the dispensaries, and they're going to be all over the state. And you're going to have one of those as well?
Yes, we have a dispensary, yes.
Is there a limitation of what you can sell, what you can charge for it, marketing, home delivery? What rules do you operate under?
Well, it's very much like a traditional pharmacy in the sense that, you don't go into the pharmacy and go in the back and take whatever you want. You have a doctor write a prescription, or in this case, it's called a recommendation, and then you have an associate who will fill it for you, and it could take many different forms: flowers to be smoked, vape pens, which is the reduction of the flower into a consumable oil, is becoming an increasingly popular way for consuming the medication, and increasingly products like ours that are more in traditional pharmaceutical forms. In Maryland, although we allow what are called edibles, or things that are also have a food-like nature, they're allowed under the law. The state has not yet promulgated the food safety requirements to allow you to make those. So we're still probably a good year away from having a more fulsome offering, but we're going to have a pretty good offering of different types of medicinal products and different routes of administration and different forms.
And the way you're going to differentiate yourself in part is by branding. You mentioned Dixie, I think?
Well, yeah, we're branding on 2 levels. Our company, Curio Wellness, is developing a proprietary line of branded products derived from cannabis, but scientifically developed and formulated. We have a scientific advisory group that we work with as part of our company, and we're taking much more of a traditional pharmaceutical discovery and development route than most people are. We also have the Dixie line of products, which I would call are more general. So they're high quality, they're manufactured, it's the #1 brand in the country, and we're the licensee in Maryland. So we'll have those available in November along with our own flowers. And then the Curio branded products, which are really indication specific, will start being seen in the market the first of the year after we finish some clinical trials.
a potential customer for you needs to register actually with the state
Yes.
to buy?
Yes, it's a very simple process, though. There's no mystery to it. It's really one of being able to protect oneself, so that, for example, if you're out somewhere and you get pulled over, or a police officer discovers that you have some cannabis, you need to identify that you're legally bound to have it. So by registering, you can then get a card, and that way the police, when they check, they can easily see that you're registered, and no harm, no fail. So it's really for your safety. There's no real intrusion in your health relationship. So that's one of the real benefits of the Maryland program, is that the legislature had the good foresight to not interfere with the patient-doctor relationship. That does happen in other states and has stifled the programs. Here, the doctors, it's really just it's a registry that's more informational for the state. Same thing with the patients, and then the relationship is really between the physician and their patient.
Let's talk about the legal side of this a little bit, because marijuana has been decriminalized in Maryland for recreational use, but not legalized. And then from a federal standpoint, it's still illegal. The previous administration and the Justice Department kind of looked the other way. The current administration maybe taking a closer look at what happens. And how do you do business? How do you pay people? How do you buy raw materials, access the banking system for something that might expose banks or others to federal issues?
Well, it's interesting. In the prior administration, they did provide guidelines to financial institutions on how they could do business with legal entities in states where cannabis had been legalized. So here in the state of Maryland, Severn Bank decided to undertake the administrative burden that the federal government requires, and so there's full banking available through Severn Bank. That's happens to be our bank, and we make deposits, we write checks. We're a normal business like anybody else. So one of the myths that I think we're now debunking is that this is no longer an all-cash industry. There will be banking services, and most of the companies that I know so far and have talked to have them in one form or fashion. So I'm sure there'll be some cash, but we're moving to a more normalized market.
You're involved in industry associations as well. There are a couple of other legal things happening. The court case in Baltimore City with an appeal from an applicant for a license, apparently allegedly bumped for geographic reasons. There's the matter of the Legislative Black Caucus, which would like to see greater diversity in the licensees. How does the industry made up of the current licensees look at those potential issues?
Well, right now, I think we're focused on the patients. This has taken too long to get off the ground, and the lawyers are doing what they do relative to protecting our rights and making sure that the program is implemented as the law said, and the courts will figure out whatever they figure out. We think it's important to be focusing on getting product to patients and making sure that folks who have really needed this alternative source of medicine don't wait any longer, and that's really what we're kind of focused on with a laser.
Before we go, take us a few months down the line. So we're at the end of the year. What does the Maryland cannabis industry look like?
I think it looks like 20 to 25 dispensaries kind of scattered around the state, increasing supplies of product every day with more variety, more depth of variety, and more different administration forms. I think you'll see that market accelerate pretty quickly, but it's gonna be kind of parabolic, slow at first, and all of a sudden it'll shoot up once we've gotten the channel filled up.
Michael Bronfein is CEO of Curio Wellness. Sir, thanks for the time.
Thank you.